And it's very taxing.
Exactly, and as a neurosurgery registrar, you do work long hours. Obviously,
So make sure you get your divorce before the training, because doing a divorce during your training will be very hard.
It's popular to get one after you finish everything.
Okay, right. Yeah,
but I'll leave it at that.
Hey guys, and welcome to another video. Dr. Sil here, junior doctor from Sydney, Australia. And today I'm talking to Dr. Kaishin Tanaka. He's the registrar on the neurology team that I'm with. Thank you so much for having a chat to us.
No worries.
I feel like you've done almost every term that's related to brains. You've done neurology, neurosurgery, neurointervention, and I thought it would be great to talk to you a little bit about the basic physician's training program, your pathway, why you love the brain, and your story.
Yeah.
So first off, though, I'd like to know, was there ever a patient case or anything that you saw clinically that made you like fall in love with the neuro side of medicine?
I don't think there's a specific case that made me think, oh, like neuro is what I want to do. Oh my gosh.
This is a realistic.
Okay.
What is it?
It's going to be in a stroke call there.
It's a stroke call. Oh, we're not the team in charge of stroke right now, so there are doctors going to that stroke call. Don't worry.
What was I saying? So so there hasn't been a specific patient. There's been several patients along the way, which has made me, or which has affirmed my interest in the field. I think for me, my interest in neuro started when I was a medical student. As we were going through our rotations in different specialties, when I got to my neuro rotation, just learning the science of everything and learning how there's still so much that we don't understand. How you could read a textbook and they would have a name for an anatomical part of the brain, but they don't know the function of it. It just, fascinated me and made me want to go into that field to understand it better. And also maybe understand myself better as well.
Really? So it's kind of like you're using your own brain to discover your own brain?
Somehow I felt like that could satisfy that kind of curiosity as well.
How much of the brain do you think we actually understand?
I think...
As a percentage?
I think the answer to that question changes every year that we get more research and
Does it get bigger or smaller?
Yeah, I think it gets smaller. It's like we think we've gotten somewhere and then we realize, oh wait, actually there's this whole other side of things that we didn't know about, and it just opens up more questions.
More questions.
Yeah, exactly.
I reckon that begs the question, like, do you think we would ever fully understand the brain? And if we go along that trajectory of thinking,
I think that when you start going into that, it kind of ends up being a philosophical discussion about what is the brain, what is consciousness, like what does it mean to understand the brain?
Well, we deal with that.
Yeah, exactly.
You deal with that in neurology all the time.
Exactly.
So what are some of the interesting cases you saw?
Yeah, so from when I was working in intervention, there was a case with a child, about 7 to 10 years old. He came into our hospital after he was playing on a seesaw, and he'd just fallen off and became completely unconscious after that. He came to our hospital. We found that he had a lot of blood in his brain, and after they did a contrast scan, they could see that he had this enormous aneurysm that was taking up like a third of the size of the space in his skull, essentially. Yeah, it was huge aneurysm.
Do we think that was obviously there before the fall?
Yeah, it was before. No one had,
it?
obviously hadn't had scans for whatever reason. I mean, he wouldn't have had to. He was fine up until that point. And this aneurysm's obviously ruptured. And
so he's been living with this aneurysm the size of a third of his brain his whole life. He falls off the seesaw.
Falls off the seesaw, it's popped, and so he's had this massive hemorrhage into his brain.
So guys, the aneurysm is when a blood vessel is dilating. So someone had an anatomical abnormality, so a big blood vessel, and then it's weakened because it's so dilated, and it's popped after a fall.
Yeah.
Yeah.
So he came to our hospital because he was in the area. He would have otherwise gone to a children's hospital because it was such a critical case. He came to us, and then that's when I was involved from the morning. He came in the morning, and we were basically trying to figure out what to do with him for the entire day. So he went to the interventional department first, we tried to coil the aneurysm and stabilize the bleed.
And just to kind of break that down a little bit for like medical students and people who don't do medicine, coiling an aneurysm.
Yeah, you're basically also then filling up that kind of enlarged blood vessel with a bunch of metal coils. So it just physically blocks blood from flowing out through that.
Right, it's actually
aneurysm.
plugging it off.
So it's
So it
plugging up
stops the blood flow.
Yeah,
Right.
by filling it up with something else, essentially. Yeah. So we tried to do that, and it seemed to be somewhat successful, but he was still very obtunded and obviously unstable. So
Unconscious.
unconscious. So he needed to have surgery to decompress that, which I also got the privilege of scrubbing in for as well. And so I got to see them decompressing this child's brain.
So how did they do that?
So opening up the skull, essentially, just making an incision, a rather large one, taking out a piece of bone, and just letting the brain relax. And
So
then
when they take the bone off, is it a circle that they kind of pull off? And do you see the brain?
you see the brain
just swell right out?
You see the brain swelling out, and you can see how tense it is. You can see the blood as well that's surrounding the brain.
Do they remove some of the?
Yeah, you gently kind of wash it off. Try and release some pressure. But you're basically just trying to take out the skull so the brain can just expand out, have room to expand. It doesn't get constricted in the confined space of the skull, because that's the main concern. If a brain is got too much pressure inside and you don't relieve the pressure, then it damages everything in there. It just leads to permanent deficits, basically.
What happened after?
So after that, he stayed in the ICU for just overnight, just because they wanted him to be stable for transport to a children's hospital. And he was subsequently transferred. Following on from that, we did a review of his imaging on our end, and we found, unfortunately, that he actually had suffered another stroke, whilst he was having the interventional procedure, which we couldn't see at the time because he was being rushed off to surgery and everything. And it was one of the reasons why the Children's Hospital was actually having a lot of difficulty waking him up from his sedation. So unfortunately, what had actually happened, we had found, is he had developed an ischemic stroke. So there was actually a clot that developed in one of his other blood vessels. As a result,
unrelated thing?
It's a complication of trying to do the coiling procedure.
Right.
Yeah.
Because that's one of the risks of coiling procedures. So
Causing
you're
a
fixing
stroke,
one problem that saved his life that day, but caused
another problem. Yeah.
They have to manage longer term.
Exactly. Yeah. So he just this kid had everything that could have gone wrong.
That's an awful case.
Which is very unfortunate. But I think for me, it just showed me, how much we can do. It showed me how much care needs to be taken within this specialty and within treating someone from a neurological point of view.
Yes, and what I remember, like I did a neurosurge term as a student, and that was the one where you would see people go from very unconscious to very conscious very quickly.
Exactly.
If everything worked out,
can
but then if things don't work out, like things can go bad so quickly, and it's all about you just have to be so careful.
Very, very.
Sometimes you can't control it, obviously.
Of course, complications can happen without your control, and that's one of the other sides of it, I suppose, just having consideration of the fact that when you're the one who's doing these procedures, a lot of responsibility is placed on your hands. It's a lot of privilege, but it's also a lot of responsibility.
And it's a privilege to have that responsibility.
Yeah, exactly.
It's honourable.
Yeah.
So how were you? Did you always want to do medicine, or what was your pathway into the medical world and then into neurology? Were you born in Sydney?
No. I've had a very complicated backstory. I was born in the US.
Oh, okay.
Born in the US, grew up in the UK, came to Australia around high school, just before high school. Wanted to do medicine, I'd say, from first year uni. Did
you have an English accent when you got to Australia?
I did, very, very strong.
I'm wondering if now I can actually kind of just, if I can hear it.
It was much
it's
stronger.
A cocktail.
It was much stronger when I first was in Australia, and then it kind of, dissolved a little bit, I suppose.
Happens.
But yeah, I'd say I think I wanted to do medicine from when I did my first year of university.
And what did you do at university?
I just did a Bachelor of Science as my undergrad.
Okay, and you did a bunch of different science courses.
Yeah, I majored in medicinal chemistry,
Oh, right.
So I had some exposure to biomedical sciences, and that's really what I think made me want to pursue medicine as a career.
And so then did you do postgraduate medicine?
I did, yes.
Whereabouts?
University of Sydney.
USyd, yeah. How did you find that?
Overall, it was fine.
People find it very overwhelming when they've done it. Like, you did a science undergrad, which gave you a bit of a footing, but still people find it like super...
That is true, yeah. I mean, there are definitely parts of doing the course which were difficult. And I mean, medical education is something that I think is still an ongoing process of improvement for all, in educational institutions around the world. There's probably no perfect way of doing it, but it was definitely a help having the science background. Definitely had some difficulties with ongoing clinical learning as well. Like, it's difficult. I understand from an educational institution's point of view, it's difficult to always have clear guidelines as what to learn, because it's always changing and there's lots of things. But I suppose that was what I found difficult sometimes, was just knowing what I needed to know and how much I needed to know, and it's difficult for anyone to kind of define that as you go along as a
So do you think that's
I think.
why it's so hard to teach medicine? Like, you're saying how it's a process of improvement, which is a very nice way of saying it's imperfect globally. There's no perfect medical course.
Yeah.
But why is that? Why is it so hard?
Yeah,
What do you think?
I think definitely the fact that there's just so much stuff in medicine. Knowing as a medical student what you need to know and what you can sort of maybe just know roughly about is difficult. Especially when you get thrown textbooks from every single direction and you're just like, do I need to learn all of this? And then
one of my pet peeves of medical school is when a niche specialist comes in to do a niche tute and gives you a textbook to read, the whole textbook. It's that's unrealistic. We can't read a textbook on every specialty.
Yeah.
Guys, just be realistic. What do we need to know when we call you for help? That's what we need to know.
Exactly. Yeah. So it can make things difficult when you're trying to study for exams. If you hadn't really had that kind of framework to begin with, you may have been kind of reading things which may not have been what they wanted you to know about in the exam.
Yeah. No clear boundaries.
Exactly, yeah.
Know everything about everything. That's how it felt.
Yeah, exactly. So I think that was one of the main difficulties I found.
Okay, so then you made it through medical school. Congrats. Yeah, that's not easy for anyone. And tell me about your junior doctor years.
Yeah, so I did internship at Royal North Shore Hospital, and then I was a resident there as well. And then I did an SRMO year, which is a senior resident year after that.
That's what I'm doing next year. So this year I'm a resident.
Yeah. I really liked working at Royal North Shore Hospital. I think it was a great hospital for me to train at and learn the basics.
Did you do any neuro or neurosurgery
absolutely.
as a junior?
I did a neurosurgery and a neurology term.
Oh, wow.
And I got also some exposure to other terms. I did a lot of cardio-related things as well.
Well, that's good, because the heart and the brain, the two most important organs, some might argue. Yeah. A lot of strokes, of course, because of bad hearts.
Yeah. I was also very fortunate that Royal North Shore is a hospital that does interventional neuro procedures as well. So I got exposure to that through my hospital.
In a neurology term?
Neurology and as a senior resident as well.
And did you do a specific neurointervention term?
Correct, yeah. So my senior resident year was focused on neurointervention. Okay.
And for people who don't know what, for medical students who are interested in the brain and want to kind of understand what neurology versus neurosurgery versus neurointervention is, how do they split up and what's the difference between them?
Yeah, I mean, it's, as with other specialties, you can kind of look at the organ systems as a split of a surgical versus a medical type of thing. So neurology is the medical side of the neurological system and the disorders of it, and neurosurgery is obviously the surgical side. Really, the split just comes down to the types of pathologies that you're dealing with. So if you're having tumors or other kinds of lesions that physically need to be cut out, that's
there's no pill that can remove.
You can't really do much
if
other than just going in and doing something about it surgically. On the other hand, if you have something that you cannot cut out or you can't go in and do something about, like a stroke or someone who has a demyelinating condition like multiple sclerosis, then you need to treat that with medication, and that's where the neurologist comes in.
Okay. And so you did your residency in the neurointervention, and now is this PGY?
This is my PGY 7 year actually.
Yeah, so you're 7 years out, and we're up to 4th year of your junior doctor years.
Yeah. So I did 2 more years after that as a neurosurgery registrar.
Oh, right, you did that as a senior as well, as a registrar.
As a registrar, yeah. So.
And did you want to get on the program? Were you trying to be a neurosurgeon?
I did want to. I mean, neurosurgery and neuroscience, that was something I'd always been interested in. I wanted to try giving neurosurgery a go. Obviously, it is a much more difficult pathway to pursue in terms of getting onto the training program. And so my rationale was to give that a go first and make sure I have like all the relevant experience to give it a proper try, because it's much easier to go from something competitive to something that's not as competitive to get into if you did want to change specialties.
So from neurosurgery, high competition, do your best to get on, and if it doesn't work out or they expect too many years out of you, you can then go for a neurology, neurointervention, which is still competitive.
Which is still competitive, but the competition for that is not at the training stage, it's actually at the consultant level and the sort of senior level. So it just meant that I could progress my training along as a junior quicker and get to an area that I'm interested in, still want to work in, anyway.
Sooner.
Sooner.
And did you apply for the training program and do interviews? And what were they like? Were they pretty nerve-wracking to get on the neurosurgical interview?
So I only went through the application process once. Okay. I'd basically just had to sit an exam and then go through with my CV and references and everything. That year I didn't have the curriculum or the CV points that they needed, and so I was doing that as a trial run.
Right.
And then subsequent to that, they changed the entry requirements for getting into neurosurgery, and so that would have added on 2 more unaccredited registrar years, which I had considered doing, and I was almost going to just stay at my other hospital that I was working at as a neurosurgery registrar previously, but then I sort of felt as though like neurointervention was something I had done as a senior resident, as I said before. It was something I could see myself doing as a career. I was very, very interested in it anyway, and I could go through it as doing physician's training as well, and I felt
without needing to do all the unaccredited years,
and I could just
and
progress
applying
through that
again and
quicker.
again, costing 10.
Yeah.
Like you have to pay. How much does it cost to apply to it?
So the exam itself, I think, maybe cost me about $5,000.
$5,000 for an exam. Yeah. Is it multiple choice?
It was multiple choice.
That's horrible.
Yeah.
There's nothing in that should cost $5,000. That's so bad.
Yeah.
But that's really rough. $5,000 for a multiple choice exam. Okay, and so what's the normal pathway? So you do like for people who are interested in neurosurgery training, can you explain the pathway to become a neurosurgeon and compare that to the BPT neurology pathway?
Yeah. So neurosurgery in Australia, basically you just, to get onto the training program, which is 5 years, I think, 5 or 6 years, you basically just have to get into the accredited college program. Yeah. So that's the Neurosurgical Society of Australia's college training program.
Yeah. So you've done med school, you've done your intern and residency, and then you're a resident, and then you're applying. Then you're working as a registrar, applying to this, the college. Yeah. And then
that's your
then
goal.
When you get on, it's 5 years, but it takes years to get on.
Yeah, exactly. That's your goal, at least from finishing as a resident to then moving forwards to neurosurgical training. Is to get onto the program, basically. And to get onto the program, you need a combination of things. So, as I said, there's an exam that you have to sit every year you apply. You have to get a certain score on that exam. It's just a neuroanatomy-based exam. You have point requirements on your CV, and that usually consists of things like experience as an unaccredited neurosurgery registrar, things like publications, presentations, posters, and also your references, so previous consultants that you've worked with, vouching for you.
And it's very taxing because you have to work full time Like no part-time applications really.
No.
Real, like if we're being honest, get in.
Yeah.
And then you have to do the research and the audits and the thing, the
Yeah,
points
yeah.
boosters
You
on
do
top
all
of
the
full-time work.
extracurricular stuff.
And full-time work has heaps of overtime.
Yes,
As a
yeah,
registrar,
exactly.
you're the one who's there in the weekends.
Exactly, and as a neurosurgery registrar, you do work long hours. Obviously, you.
So make sure you get your divorce before the training, because doing a divorce during your training will be very hard.
It's popular to get one after you finish everything.
Okay, right. Yeah,
But I'll leave it at that.
It's much easier to get a girlfriend or a partner afterwards. It's harder to do it during. Yeah, fair enough. Okay, and then once you're on with those points, then it's just as per the college requirements.
Yeah. Then you just, once you're on, it's usually smoother. You just do what the college wants you to do. It's not easy either when you're on, because you're still at the mercy of the college, because they can send you to whatever hospital needs.
Really? They choose where you go?
They do. You put in preferences, but they will ultimately say where you go. And it's because it's an Australian and New Zealand-based organisation, so you can potentially be sent to New Zealand. Wow. You can potentially be sent to other states in Australia as well. Yeah.
And then there's an exit exam, because I remember one of my registrars when I was a student doing neurosurgery that was a really tough exit exam to becoming the final big boss consultant.
Fellowship exam. Yeah. It's a. I only know roughly what it involves. It consists of a written paper as well as an oral viva. Yeah, the oral viva is tough. And that's when they grill you on cases and get you to...
most minute of information, and a lot of pressure.
Yeah.
And I'm sure that costs a healthy bit.
I'm sure, because it involves real people.
Yeah. So that's the neurosurgery pathway. What about neurology? If I want to become a neurologist, what do I do?
So neurology in Australia, it's a medical specialty through the College of Physicians. You have to complete basic physician training, which is training which makes you go through multiple different medical specialties.
It's what we call BPT. Whenever we use the term BPT, it's basic physician training. So it's a registrar, so more senior than a resident, less senior than a more senior doctor.
Yeah.
And you do a lot of medicine. So you need to know your renals, you need to know your geriatrics.
Exactly.
Even if you want to be a neurologist, you need to know it all.
Yeah. And then once you've done all the required things in BPT, you sit your exit exams, I guess, for BPT, which consists of a multiple choice exam, which covers the whole of internal medicine. It's basically like a medical school exam on steroids.
Right.
I can't imagine that. Yeah, and then you do your clinical exams.
And you just did what? Because you've just finished some exams.
Yeah, I've just done the written. Yeah.
Okay, and there's also the OSCE. Is that what you're saying?
No, I haven't done that one yet.
And that's coming soon?
That's coming if I pass the written.
Fantastic. So you have a little bit of a time now. You finished your written. You don't know your results, so you can be existential about that.
I'm in limbo, but I'm not obligated to do anything at this point because there's no point at this point.
A little bit,
yeah. Yeah, so if I pass these exams, I will move on to clinical exams, which are the OSCEs.
Right.
And again, that's just basically where they assess you on your ability to examine patients and formulate detailed plans and management, plans and then. Yeah.
And then you become what? An advanced trainee?
And then after that, that's when you break into your chosen subspecialization. So for me, I'm going for neurology. But it would be, you could choose medical oncology, you could choose renal medicine, cardiology,
whatever you want. Yeah, cool. So it's a marathon, really, isn't it? Like you've been doing this, you're PGY 7? 7, yeah. 7. Yeah. So you're like 7-8 years out of med school almost. How do you balance the work-life balance? Or have you had problems with burnout, or has it been a pretty cruisy ride? Everyone's different, right? Everyone can handle different intensities of workload.
Everyone is different. I mean, I think just my personality, I think I am drawn to kind of high pressure situations and fast paced kind of things. And so I really loved my time as a SRMO and neurosurgery registrar. I think I learned a lot, and even though it was hard work and long hours, I enjoyed everything. I learned a lot.
Right. So can you say that you haven't had burnout?
I never felt burnout personally. I think my interest in my specialty has kept me going.
Yeah.
And that's not awesome. Not everyone can say that. Lots of people obviously don't have the same kind of feeling towards, whatever training they do. And, that's just everyone's different. Yeah,
everyone's different. That's
Yeah.
right. All right, thanks so much for chatting, Kai. I think we'll have to wrap it up now because everything's running out of battery again. But before we go, what's your favorite part of the brain and why?
Yeah, that's a very difficult question, I think. Because I think the brain is just a single organ, but if I had to say something, and it's not really a specific part, but it's, I don't know, the grey matter of the brain. I mean, I guess that's where...
The cortex?
That's just where the stuff happens. Yeah, that's where...
So what is the grey matter? Give us a little rundown.
Yeah, the grey matter is basically, as the name suggests, it's the grey colour part of the brain, which if you see it in your, textbook pictures of cross sections of the brain, it's the kind of the outer layer of all the nervous tissue, and it's basically where all the nerve cells are.
Yeah,
basically.
And it's where all the fun happens. That's where all the thought and consciousness and stuff is really happening. The rest of the brain is just like circuitry. It's just getting information from point A to point B, as far as we know.
Yeah, as far as we know.
If you look into it, maybe we're wrong and there's more questions to answer.
The connections are probably just as important as the cells themselves nowadays.
Right.
So,
probably. Thank you so much for the chat. Just for the record, we don't represent the College of Physicians or anything. Yeah, this is informal advice, so make sure you double check everything with the websites. Thank you so much for the chat.
No problem.
We've got to go back up to the ward, and I'll see you all in the next video, guys. Don't forget to like and subscribe. See you guys.
Yeah.
Thanks, man.
No worries.
That was fun.